Well, good evening, and welcome to the second installment in a series of 6 virtual town halls being presented by the New River Valley Public Health Task Force. We appreciate you welcoming us into your homes or wherever you may be viewing this event. Beginning this week, in each subsequent town hall, we'll be joined by Doug Williams, who is providing sign language interpretation services. Thank you, Doug, for your assistance with our series. You will learn as we move through our program, the New River Valley is blessed with leaders who care deeply about our communities, and they truly work well together. As a result, our citizens should feel confident as we collectively navigate COVID-19 in the New River Valley. My name is Kevin Bird, and I'm the Executive Director of the New River Valley Regional Commission, and I have the pleasure of serving as moderator for our virtual town hall series. The New River Valley Public Health Task Force I referenced earlier has been hard at work since early March, aligning resources and deploying strategies to support the public health needs of our region. Nearly 3 months ago, local law enforcement, fire and rescue organizations, hospital and public health officials, local government managers, local public information officers, education officials, and others began to develop and activate regional plans for the COVID-19 pandemic. Since then, the New River Valley Public Health Task Force has been working through phase 1 mitigation, providing increasing levels of testing to all communities in the region, and securing testing resources and protective equipment for frontline medical and public safety personnel. Each week since March, the task force has provided scalable drive-through test sites across the NRV with faster turnaround for test results. The task force also prioritized clear and consistent messaging and an abundance of public information, a result of which is this 6-week series of virtual interactive town halls with our second one tonight. As our series continues this week with the topic of law enforcement and emergency services, the panelists assembled this evening are directly involved with the New River Valley's response to COVID-19. The questions they will be addressing were submitted by residents across the region prior to tonight's town hall. For more information about this series and to submit questions for future panels, please visit www.montva.com/NRV Town Hall. You may also submit live questions via Twitter by using the hashtag NRV Stronger Together. And we'll answer them as we're able, the time permitting. As I introduce each panelist, they'll provide a brief introductory statement. First on our list this evening is Hank Parton. He is the sheriff for Montgomery County.
Good evening, everyone, and thank you for having us into your homes. And hopefully with some of your families, you'll get to meet those of us who are trying our best to take care of our communities in the New River Valley. So COVID-19 has certainly changed our lives, and it's changed our field of business as well. In my 33 years, I've never had to experience or deal with anything like this, but we're all navigating these waters together. So I can tell you that there's nowhere else I'd rather be than with those that I'm working with now. And just like in any other times of crisis, we always come together, and that's exactly what has happened with our public health task force and all my brothers and sisters that we've been working with. So it's a pleasure for us to serve you, and I can promise you that all of us and our agencies are doing all we can to keep everyone safe.
Thank you, Sheriff. Next, we have Mark Sisson. He is the Chief of Police for the town of Christiansburg.
Yes, thank you, Kevin. I've been the police chief in Christiansburg for 13 years, and I'll echo some of what the sheriff had mentioned. We've had crisis in our community in the past. We have crisis now with COVID-19, and we'll have crisis in the future. But the most important thing is that we come together during crisis in this community, and us coming together is going to lead us to recovery. We know that the work of the task force and everyone that's involved tonight has worked diligently for the past 2 months to get us on the road to recovery. And I'm simply blessed to work with such professionals in this region, and look forward to recovery and look forward to tonight. Thank you, Kevin.
Great. Thank you, Chief. Next, we have Anthony Wilson. He is the Chief of Police for the town of Blacksburg.
Good evening. I'm Anthony Wilson. Like I said, I've been the chief of police in Blacksburg for the last 6 years. And like I said, don't want to sound redundant, but a proud member of our task force from the onset. We learned through adversity a lot of hard lessons in the New River Valley. But the one good thing is everybody you see on this screen today and a ton of other folks are all connected to make sure that we can keep this community safe. And I think there's never been a time I've ever been a prouder citizen of the New River Valley than today, and the job that's been done here. So thank you, Kevin.
Thank you, Chief Wilson. Next, we have Mac Babb. He is the Chief of the Virginia Tech Police Department.
Thank you, Kevin. Again, my name is Mac Babb. I'm the relatively new Chief of Police at Virginia Tech. I've been in the community about 5 years, and it's certainly been very impressive to be a part of this larger group and help to kind of contribute and do our part to make sure that we're keeping the entire community safe during this pandemic. Thank you.
Thank you, Chief. Next, we have David Underwood. He is the Chief of the Radford University Police Department.
Thank you, Kevin. Appreciate it. It's great to be a good part of this conversation, the task force, and working with everyone here. So it's been a very great team. I'm looking forward to continuing working with the New River Valley Task Force and trying to get a handle on the COVID-19.
Thank you, Chief Underwood. Next, we have Gary Roach. He is the Chief of Police for the town of Pulaski.
Thank you. I'm in my 20th year in service in the Pulaski community and enjoyed every year of that. And we have had our challenges in the past as well, but I'm not sure that we will ever, and I hope we never have one that is going to be as serious and as long potentially as the one that we have. I really appreciate the opportunity to participate with this group, and we all are aware that in this particular circumstance, everyone is everybody's brother and sister's keeper.
Thank you, Chief. Next, we have Jeff Dodson. He is the Chief of Police for the city of Radford.
Thank you, Kevin. I'd like to thank you and the other law enforcement and EMS and fire partners a part of this panel, and also the public health task force for inviting us here tonight and being able to share with the citizens the good work. I've been the police chief here in Radford for 5 months. Prior to that, came from Culpeper. And one of the things that I find truly exceptional just in the 5 months I've been here, and certainly facing this new health crisis that we're facing with COVID-19, is the teamwork and how the community and the partners here on this panel have come together to address this. And I think it's wonderful that we're going to be able to share with the community tonight what good work we're doing to keep them safe. Thank you.
Chief Dodson. Next, we have David English. He is the Chief of the Blacksburg Volunteer Rescue Squad.
Thanks, Kevin. Yeah, thank you guys for joining us tonight. My name is Dave English, and I am the Chief of Blacksburg Rescue. Been a volunteer at Blacksburg for about 16 years now, and I am a paramedic, and I've been pretty actively involved with the task force as well. So I'm on tonight not only to represent my agency, but also all of the EMS partners that are in this region.
Very good. Next, we have Billy Hanks. He is the Fire Chief for Christiansburg Fire Department and the Emergency Coordinator for the town of Christiansburg.
Thank you, Kevin. I am Billy Hanks. I've been on the fire department in Christiansburg here now for 38 years. It's been an honor for me to be the chief for the past 10. In my career, I don't think we've ever witnessed anything like this COVID event, and hopefully we will not witness anything like this again. But we've worked diligently with the task force. Proud to be a part of this organization and a part of this group. We do come together better as a group, and we succeed as a group, and I'm proud to be here.
Well, thank you to each of our panelists for joining us this evening and providing insight on the response to COVID-19 in the New River Valley. We're going to start off with a question that I'm sure all of our panelists have a response to. How have public safety procedures, dress, behavior, interactions, and perhaps other operational aspects of your work, how are they different now than they were just a couple of months ago?
Kevin, I'll start as chief citizen. We want our community to know in that respect that we're still doing our jobs the same way. Our vision is to protect our community, and that's what we're doing every day. Some of the things that may be a little different, we want citizens to know that our internal procedures have been developed for our officers when they respond to citizen complaint. When they make contact, they're wearing masks and goggles. So visually, that's one of the only things that you'll see different as a community member is that we have asked them to mask and goggle. And we do that to provide safety for the resident and also for our first responder, because simply we need to keep our first responders healthy. And that's how we continue to provide service to our community.
And I'll echo what Chief Sisson said. For our officers, we did outfit them with as much personal protective equipment as we could. We are also putting in place that our citizens have different ways to contact us now. They can report crimes through the internet. They can also, we have a robust phone call-in system. So like I said, as far as what you'll see, we are still continuing to provide 24-hour service to our citizens, but we are empowering them with the best personal protective equipment that we have, and trying to get as many venues for the public to get in touch with us as safely as possible.
Chief Wilson, you were talking that residents can report over the internet anything they might be concerned about. Can you explain that a little bit further?
Yeah, we still, I prefer that our officers do a lot of face-to-face, interviews and correspondence with the public, but we realize also that our officers could end up being a vector for transmitting, this virus throughout the community. So we wanted to use technology to our best advantage. And so we created internet reporting, and some of the agencies that are here today, I know MAC and some of the others have already been doing that. So I'd be lying if I said I didn't steal a little bit from them, but it really is, it just gave us a lot of different venues that are citizens. They can simply go onto our webpage, and we have a tab established where they can report a crime through the internet. It'll always be investigated by a police officer. You'll always hear back from us. But it was just one of the many ways that we could create safe avenues for our citizens to keep in contact with a police officer.
And Kevin, I'll just add in, this is Jeff Dotson from Radford City. When very early on in the process, we implemented an online reporting system as well. Citizens can go on, and certain types of crimes they can choose from a drop-down menu. Obviously, if it's something serious or in progress or things like that, we are not allowing online reporting for that. But certain frauds and certain type of informational complaints that they want to report to us, they can do it online. We've also encouraged our officers to handle some calls via phone calls to citizens if it can be handled over the phone to limit exposures. So we're encouraging that as well.
And we've done the same thing, Kevin, with the phone call. We don't have the capability as of yet for internet reporting, but we are trying to control interactions in non-emergency situations. If it is a emergency call, then we will respond as we always have.
Okay. Well, if I am experiencing an emergency and I need to call 911, what should I expect? And is it safe to call EMS if I'm having an emergency?
Yeah, Kevin, I can answer that one. So for the first part of your question about what to expect, really the only difference on the phone when you call 911 is that some 911 centers are going to be asking a few more questions to figure out if you have certain risk factors, if you are diagnosed with COVID-19 or if you're living with someone that is, and they can just relay that to emergency responders. Either way, no matter how you answer those questions, we're still going to come and we're still going to help. It just allows us to be a little bit better prepared as we are responding, and so we can plan ahead. And as far as, is it safe? You know, I think it's about as safe as it possibly can be. All of our responders, as far as EMS goes, are taking precautions. So just like law enforcement folks said in the last question, EMS is doing the same thing. So anytime we are out in public, or especially if we're responding to an emergency, we're going to be wearing a mask and eye protection, gloves, and we're also going to typically ask the patient to wear a mask as well, and we'll provide that. So we'll give them a mask, but that just protects them, and especially, you know, throughout the entirety of the interactions with us, that just provides some extra protection for both them and for us.
So if they're calling 911, are they putting themselves at any greater risk by going to the hospital?
Not really. So the hospitals are actually doing a great job of putting things in place to mitigate that risk. So the hospitals have either limited or eliminated completely visitors, except for certain circumstances, and that depends on the hospital. But they've also really increased their cleaning and their other, you know, precautions. So I would say people shouldn't go to the hospital just for fun, as that's always been the case. But if you're actually having a medical emergency, then we definitely do recommend that you go to the hospital and that you get checked out. The fear of risk of COVID-19, we don't want that to outweigh you going to get medical help in an emergency, because sometimes delaying care can have a negative
Absolutely. Well, Virginia is approaching phase 1 of reopening. We're receiving lots of questions this week about the potential need for enforcement. Which agencies have responsibility for enforcing guidance on social physical distancing, crowd size, and other individual behaviors that may affect the COVID-19 risk? And might direct that to Sheriff Parton or Chief Sisson first.
So Kevin, all of what you have mentioned is going to fall into our bailiwick. All of us have been very impressed since the beginning of this crisis with the way our communities have reacted. They have done a fantastic job of basically self-policing themselves. When, you know, we're living in an era when it seems like every other day there's a new executive order that comes out and kind of throws us all into a, you know, turmoil for 30 minutes trying to figure out what changed from the day before. But, you know, the biggies, the social distancing, the hygiene, all of the safety net features that we live in now, everybody that we come in contact with, for the most part, have just done a tremendous job. And, you know, we've been able to mitigate a lot of situations that we've been in just by re-emphasizing, you know, the governor has stressed that we should be doing this. It's to keep everyone safe. And, you know, once we put that word out there, we usually don't have to revisit. And obviously that's not 100% of the time, but I've got to tell you, and I know I'm not just speaking for myself, from the law enforcement standpoint, we've seen people really stepping up, and we're thankful for that.
I guess the only thing that I would add to that, to piggyback on what the sheriff has said, we have talked about this in our meetings and our task force meetings about how socially responsible our community has been, not only our citizenry, but also our business owners. Many times our roles change in law enforcement. You know, most people look at law enforcement as law enforcement, but we've become educators. We have to adapt to the different general orders that are coming out and be able to relay that to our citizens and help our business owners understand that and try to get them back on the path to reopening and being productive in our community.
Well, I'm thrilled to hear about all the positive steps that individuals and businesses are taking. That certainly bodes well as we take the next step. You know, if a citizen sees a situation they're not comfortable with respect to crowd size and you all receive a call, how would you all respond to that?
Well, I can say that we have received those calls, and I think every law enforcement agency represented has received those calls. You know, our plan moving forward, respective to that issue, we've responded, we've educated the community, and again, our citizens have been socially responsible and done the right thing.
Chief Roach, can you speak to the penalties that might be involved if anyone's found violating these?
Those orders contain what I'll characterize as different classes of information. Some of it is guidelines. Some of it is best practices and safe practices for everyone to follow. That's an education piece and one that we keep stressing. The ones that are termed emergency orders or that type of language could involve criminal penalties as far as misdemeanors for like the limit of 10 people to a gathering, that type of thing. That's one of those that is covered by that. Washing hands is not. So that is the extent of it. I'm happy to say that we haven't had to resort to that in any situation. Everybody has, for the most part, has been pretty responsible. And I think that attests well to everyone in our communities doing so.
Very good. This next question is along the same line, but has a little bit of a nuance to it here. Is how would law enforcement handle it if someone asked for assistance with a person who refused to maintain a safe distance? And what are some options that citizens might use for handling this type of behavior?
Well, that's one that is a guideline. It's a recommended practice. So your options are possibly to speak to the individual, remind them of what is a safe practice, separate yourself. I realize that in a line or a store that might be a little difficult or situation like that. But hopefully that will resolve itself quickly and won't escalate into something else. If it does, I'm sure that appropriate measures will be taken and one of us will be notified.
So, Chief Hanks and Chief English, can you speak to the role of volunteers in the response to COVID-19? And if someone's interested in volunteering to support, what should they do?
Sure.
Go ahead, Dave.
Okay. So a lot of the fire and EMS agencies in our region are either completely volunteer or made up of both career and volunteer. And so, you know, we have a lot of volunteers that are putting in a lot of time towards this. And most of them work full-time jobs or they're students or they have families, and they do this on the side and in addition to their other responsibilities. And really, I think the number one thing that can go a long way to support that is just to thank them, recognize the people that are out there putting themselves in harm's way every day, not just with COVID-19, but just in general. We've got a lot of people that step up all of the time to provide these services to our community and to keep our community safe. And so just a little bit of thanks, recognition, support. We've had a lot of people reach out to us over the last few months, either wanting to donate or to drop off meals for volunteers, to we've had a lot of people sewing masks, and really that, and just this saying thank you goes a long way. For the second part of your question about how people that want to volunteer can get involved from the medical standpoint, usually with EMS, it's a little bit more of a long-term commitment than something that someone can just step in and do for the short time. However, if they are interested in helping specifically for this, there's a medical reserve corps that does a lot of coordination of the volunteers for this effort. And so they can get a hold of that medical reserve corps or contact the health department hotline, and they can kind of put them in touch with those people.
Yeah, I echo what Dave's comments are there. You know, our volunteers in Montgomery County and our surrounding counties, Pulaski County, Floyd County, Giles County, they're a valuable resource to us. We don't know what we would do if we didn't have those volunteers to run fire and EMS. You take the average person that's a volunteer with a local agency, they still work an 8 to 5 job or a 12 to 8 job. They volunteer on their time off. They still have their families to take care of. They have to worry about what's going to happen if we go out here on a COVID call. What are the chances that we may take this stuff back home to our families? We've had to reassure our people that we're taking all the precautions that we can to protect our own members, and then we have the rapid testing in place that if we have a contact with a COVID patient and there's any doubt, we can have our first responders tested immediately and get those results back as soon as we can, including our law enforcement personnel, and get them back on the street to serve the public. So, you know, our volunteers are tremendous. They provide a very valuable resource to our community, and our, I would bet, community-wide, Montgomery, Pulaski, Giles, Floyd County, I bet we have well over 1,000 volunteers in these areas. I know just in Montgomery County alone, we have over 400. So these volunteers provide a valuable resource to the community.
Great. I appreciate both of you sharing that message about the role of volunteers in this. It's substantial. Chief Hanks, you were talking about testing that's available for these folks who are in these in public safety roles. Chief Wilson, do you have any follow-up on that? I know you've been close with the task force and testing. Any other follow-up for testing for public safety officials, police, fire, EMS?
Yeah, Kevin, that's a great question. And the part of the emphasis on when we first started talking about forming a task force was we saw this thing coming across the horizon, and we knew that while it wasn't going to be really in any one of our wheelhouses to fix, we quickly partnered with Virginia Department of Health, and I know folks got to meet Dr. Bissell last week, and we were absolutely blessed to have somebody of that talent in our region here. So when we got together, what we brought to the table was an enormous logistics machine. And if you look across this spectrum of folks who are here today, while none of us are doctors or medical professionals, we all are very good at providing resources. And one of the first things Dr. Bissell said is that for this region to get ahead, we need to have testing capability. And so some of our folks here, and I'll refer to them as our logistics experts, and it's Curtis Witt, who works for Billy at Christopher Fire Department. Michael Geary, you'll meet him in a later call, is our brand new emergency service coordinator from Montgomery County. Were instrumental, absolutely fantastic in finding and locating resources for Dr. Bissell's group to get going with testing. So as a result of this action, and this started way up the end of February, first weeks of March, we were ramping up our production and so on in Montgomery County. It quickly went out to be the Dewar Health District. We were able to offer testing, and not only for all our first responders, but we offered testing for all of our citizens in this region. I know they gave the public health hotline last week, and and I know Kevin, you'll probably put it back out again today. But we created a machine where all of our citizens can, if they feel they have been exposed or they feel like they might possibly come in contact with someone, we have a mechanism to test all of our citizens. Billy did respond to that through a coordinated effort with our Virginia Tech partners, we do have a mechanism to shorten the return time on testing, especially on our first responders. And I'll tell you, this partnership has allowed us, and I'm sure all the chiefs on the stage will say the same thing, is none of us have lost a first responder for more than a couple of days at max. And that was during we put them under a investigative period where we had them tested and we were able to return them safely to the job within 2 to 3 days. So it's been a remarkable process, and we are simply the grinding machine part. The brains of it is Dr. Bissell and her medical staff.
Absolutely. Kevin, there's so many pieces to that puzzle too, you know, and I'm sure if we tried to name them all, we would leave someone out. And I definitely don't want to hurt anybody's feelings, but all of our regional partners, you know, all the law enforcement agencies, including Virginia Tech and Radford University, the public works crews from the towns, the Virginia Department of Transportation got us signage to be able to put signage out to when we have test sites. Just amazing cooperation through all the agencies and the departments within these agencies. We pulled permit technicians from the building department to help us with check-ins at sites to keep accountability of all of our people on site. So it's been a real community effort, a collaborative effort between all the agencies, and I don't think you can find that anywhere else. It's worked this smooth.
It's excellent to hear. Thank you all for providing a little more insight on testing that's available and how it's conducted through those drive-through facilities. This next question is for Sheriff Parton. What measures have been taken at the Montgomery County Jail to ensure the safety and health of not only the inmates, but also the staff within the facility?
So Kevin, we recognized sometime back in March when all of this was ramping up, it became pretty visible that we needed to cut visitation. We needed to cut contact from the outside world, basically. With consultations with the Commonwealth's Attorney's Office and our judges, we decided to end weekend sentencing. We basically decided to limit all travel in and out of the jail as much as possible. And remembering back in March, we didn't know as much as we know now about transmission and everything else that we've come to learn. Through Dr. Bissell and her staff, we have recently been able to test the jail on a voluntary basis, and I'm very happy to report that we tested probably 35 people, inmates and staff, all negative, and all of that is directly correlated with the care and the work that the staff has done in that jail. They have gone above and beyond and done everything humanly possible to keep the jail clean, number one, and to keep the traffic minimized. And all of our law enforcement partners as well, they've all recognized that the jail was a critical piece to protect through this. Just like the task force has taken it to heart that we have to protect our hospitals and our healthcare facilities. The jail was lumped into the same category as it should be. And it has been a phenomenal thing to see when there have been so many crises all over the country that we hear about every day. And thank goodness we haven't had to deal with that here. And it's just a result of everyone working together, and especially Dr. Bissell and her crew. Just to echo what Chief Wilson said, They've just been fabulous to work with, and they love their community.
Thank you, Sheriff. This next question I'll direct to the panel, and I'll ask our university folks to respond first. And that's, to what extent are the first responders and law enforcement seeing and responding to wellness or mental health issues, such as depression, distress, anger within the communities?
So at Virginia Tech, in general, mental health is a significant issue across the board in university settings. With the reduction in population, certainly we've seen a reduction in calls relating to that type of incident going on, or people kind of finding themselves in crisis, which has been fortunate. Again, some of the benefits of this partnership is we've been able to kind of recreate mechanisms to make sure that we can still get the services that are needed when people find themselves in crisis. Kind of working through some of the obstacles and making sure that while we can find people the necessary tools they need when they just need somebody to talk to, and then when it's determined that they need to get greater help in the mental health capacity, that we can get people face to face with people that are able to help them. In general, I think the community's responded very well and has handled this crisis very well, which speaks volumes to how everybody in general is doing about the COVID situation.
And I'll just say, just as far as Chief Babb was talking about, I mean, the resources that we have on campus, and with the population doing online training and so forth, classes, it's been sort of reduced. I've only probably had a couple mental health calls over the last probably several weeks. We have a lot of resources out there. We have in the New River Valley, we've got a lot of resources out there, and that are taken care of pretty quickly. So I mean, it's I think you see a reduction right now versus an increase.
Anybody else on our panel like to respond to that topic?
Kevin, the only thing that I'll add is, obviously this is a stressor to our community. It impacts a lot of people in many different ways. And we know that we've had an uptick in mental health calls from a law enforcement perspective. I think our message to our citizenry is, if you're struggling mentally, then at this point you need to reach out. I mean, you reach out to your mental health providers, your counselors, and if you don't have that in place, you reach out to law enforcement, because we can be that conduit for assistance that citizen may need.
And to follow up, one other thing that Chief Sisson was alluding to is I think you heard it last week from our mental health professional and our medical professionals that fear has driven a lot of people away from attending their counseling sessions and getting the follow-up care and reaching out for help for fear of contracting the virus. But I think they also have shown that in this area we have created very safe environment to return to counseling, to return to get help, to go to the hospitals when you need medical help. But especially in this mental health field, we've worked with those professionals tirelessly to find the right mechanisms to get everybody to counseling. And it's far better to seek the service today than try to deal with a problem on their own. And like I said, if nothing else comes to mind, or you can't find the right service, simply call us and we'll direct them in the right direction.
Great. Thank you all very much for addressing that topic. This next one, I'll direct it to Chief Dodson, and we can go around the table after that. But during the time of the stay-at-home order, is law enforcement, are you all seeing an increase, decrease, or same level of crime in the communities? What does that picture look like?
So Kevin, we're not seeing an increase in crime. Actually, for April here in Radford City, we actually saw a little bit of a decrease in overall crime. One of the things that we focused on here in Radford City, we did see a slight increase in property crimes and crimes of opportunity. And what I mean by that is larcenies from vehicles, frauds, we had the stimulus package that came out from the federal government. And of course, when anything like that comes out, you always have folks that are going to be preying on the vulnerable and trying to scam or fraud folks out of their money. So we've put out several educational things on our social media outlets and tried to educate the public about frauds and scams that are out. As far as our property crimes and things, we've really encouraged officers to step up patrols of businesses and neighborhoods to combat that as well. So, but as far as crime, I would say just a slight decrease here.
Anybody else want to chime in on that one?
Well, Pulaski, we initially in March, we had a similar situation, but in April, we had a spike. Our calls for service, not necessarily crimes, calls for service was up 100%. We have property crimes and burglary that has increased, which seems to be a little contradiction in the fact that if everybody's staying home, we should be receiving calls of these people. But that has been an issue for us in the past month. The troops have been real busy.
How about fire and rescue calls? Chief Hanks, Chief English, you'd like to speak to that?
Yeah, Kevin, our fire call volume is down about 40% right now. So the Christiansburg Fire Department covers about 25 miles of Interstate 81, which there's a tremendous call volume on 81, but we've had relatively few accidents on 81 compared to what we have normally. So I think that's a testament to everyone staying at home statewide. We don't have the travelers that come through the county on 81 the way they normally do. We don't have the traffic volume the way we normally do. Our overall call volume in the town of Christiansburg, fire and EMS are both down. And maybe Dave can give us an update from Blacksburg. But I think overall, call volume is down tremendously, and that's due to the fact that everyone has taken the advice of the governor and the health officials, and everybody's staying at home.
Yeah, thanks, Billy. We're seeing the same thing with rescue here in Blacksburg. Our call volume's down about 40%. We actually tracked it pretty closely, and it was actually kind of amazing. When the stay-at-home order got issued, within about 2 to 3 day window of that on either side, we graphed it out, and our call volume plummeted down to about half of what it normally is, and it's just slowly crept back up just a little bit, but it's still down about 40% of what it normally is. And that's good in the fact that I think people are staying home and they're keeping themselves healthy and safe. But we do urge people that if they do have an emergency to still call. We're still there. We're still staffing the same that we always have. And so while we're happy that people are healthy and not being injured, we're afraid that if somebody is just fearful and not calling because of that they may wind up in worse shape. So please always call, even if it's just a matter of you want to get us to come check you out. And if you ultimately decide that you don't want to go to the hospital, that's your right. But we would always prefer to come and check you out if you need it.
Great. Thank you. Well, as the stay-at-home order is transitioning to safer at home, entering phase 1, I think folks are probably getting a little antsy to get out and about. We have the question, is it safe for me to travel to other parts of the state or even out of state? Sheriff Parton, do you want to start on that one for us?
So Kevin, as we do move into phase 1 on Friday, obviously traffic will probably pick up somewhat and folks will start moving around a little bit more. We are, as always, very hopeful that common sense will prevail. And as long as folks keep in mind everything that they should be doing and everything that we have been doing to kind of stall this thing. You know, I think Dr. Bissell really kind of answered that question last week when she said, you know, just because you travel from Virginia to North Carolina, Virginia to West Virginia, or wherever, you know, the virus does not stop at the state line. So as long as everyone remembers to do what we have been doing and they know what they should be doing by now, you know, we're just going to deal with it as it comes. And I'll just go back to everybody has been doing a great job. Let's just keep on doing it.
Great. Yeah, there's been increased media reporting about some reckless driving cases that are taking place in other parts of Virginia or across the country. And what do you all see as plans to enforce traffic laws, and what do you recommend to those who are watching?
I'll start, I guess, and it's that, you know, we've heard some of that conceptually, but you know, when I talk to the men and women who work for us who are still out, still doing traffic, that is they're seeing such light volumes of traffic, and once again it goes back to a testament to this community that we all live in, that folks have done such a good job about adhering to the guidelines and so on. But I think the public should know that we're here, we've been here the entire time, that we are urging them to use their own good sense and common sense as they start to come back out here. But I think, like I said, a lot of those rumors about people recklessly flying around, we certainly haven't had data that backs up that thing. And my guys and girls have been out 24/7 and doing the same patrolling that they've always done.
We had a question that came in that is along a similar line about safe social distancing or physical distancing, but is more directed about how would law enforcement handle someone who is intentionally trying to infect others or behave in a menacing way?
Kevin, we've actually already dealt with that on several occasions in the jail. And those folks have been charged with assault on law enforcement officer. So I can speak from the sheriff's office point of view anyway. That won't be tolerated.
And Kevin, here in Radford City, we've also received some guidance from our Commonwealth Attorney on that. We haven't had any incidents of it that the sheriff speaks of, but we have received some guidance and related to our officers from the Commonwealth Attorney's office about should that occur within the city, how we're going to handle it. So,
very good. Well, I think it's worthwhile. We have several people who are watching this program. If you all could provide some tips on being safe as it respects to theft and fraud. You talked about some fraud potential earlier. What are some best practices that people should be following with respect to theft and fraud?
So Kevin, I'll start that. I think one of the main things is if it seems too good to be true, it probably is. You know, a lot of folks are, you know, scammed on these things about getting money, or if you send, you know, a certain amount of money, you're going to get X number of dollars more than what you sent. So really just, if it seems too good to be true, it probably is. Not giving anybody any personal information over the phone or online or anything like that, not any kind of bank account information. As far as the larcenies and crimes of opportunity, just using good practices to protect yourself. If you have a vehicle, locking your vehicle is probably the most important thing you can do. Taking valuables, putting them out of sight, not leaving, you know, valuables within sight that people can see when they pass by your car. And just calling and reporting suspicious activity to the police. If, people see something happening in a neighborhood and they think that it's suspicious behavior, it may seem very little, it may seem very minor, but for law enforcement, it may be something very big. It may be something that we use to solve a bigger case. Maybe we're looking for that piece of information to solve a series of larcenies that we're currently working. So just encouraging our citizens to report suspicious behavior. They live in the neighborhoods, they know their neighborhoods best. So call us if they see something out of place.
And please check our, all of us have a website or a Facebook page or other social media that we all are constantly updating the scams as they come out, as they reappear. And I think it's important for people to realize it can and will happen to you. And what Chief Dotson said about locking cars, that's a continual problem that everybody knows you should be doing, but we have incidents of taking thefts from cars just left unlocked overnight because everybody thinks in their neighborhood no one will bother it, but people coming through those streets don't necessarily are your neighbors.
Well, I've hit you all with a lot of questions. Are there areas that we didn't cover that you all want to share some more information on tonight?
I have one point. If you're 20 years old, you got 20 years of habits. If you're 60 years old, you have 60 years of habits. And I think that's part of what some of these questions are, like if someone gets too close to you and that kind of thing. We're used to that. And as time progresses, we might back off our guard a little bit. When on Friday, when we go into the next phase, as it were, that does not mean that we shouldn't still be practicing those safe habits. The potential of this is not abated. So we need to be diligent in everything we do, just like we started, and continue that probably through the rest of this year, at least.
And Kevin, I just want to add, I know this has been hit on as well, but the community really has stepped up with this. And I think, the phase one starting on Friday, that's the first step. The governor, I think, refers to it as that dimmer switch. And we're cranking that dimmer switch up just a little bit, but I would just encourage the residents, the businesses, and the citizens just to continue the hard work that they're doing, the social responsibility about keeping themselves healthy and keeping adherence to these guidelines that are being put out, but also do it for your neighbor. Do it for the people that are vulnerable in our community that have pre-existing conditions, and just keep up the good work because they really have stepped up and done a good job.
Well, that's a great message. Any other parting words from our panelists this evening before we conclude? All right, well, our community has done an excellent job yet again submitting thoughtful questions, and it spurred some great conversation this evening among our panelists. I want to thank each of our panelists for your participation, and I also want to express my gratitude for the service that each of our panelists provides in their communities and the team members that you work with across the region on a daily basis. So as we look to the future, the Public Health Task Force is creating the playbook to help everyone in the New River Valley navigate the next phase, recovery. This series of virtual town halls is your opportunity to continue that conversation. We invite you to join us each Wednesday at 6 p.m. If you're not able to watch live, the series will be archived on YouTube. Links will also be posted to agency websites and social media. The series will also be rebroadcast on local access cable stations, including Comcast and Shintel Channel 190 for Christiansburg and Montgomery County, along with Comcast Channel 2 in Blacksburg. Additional dates and topics for the virtual town hall series include the following. On May 20th, we'll have local government. May 27th, be local and small business. June 3rd, education with a focus on K through 12. June 10th, be education focusing on colleges and universities. So before we wrap up this evening, I want to extend a special thank you to those behind the scenes who are making the virtual town hall series possible. They're the public information officers who serve our local governments, agencies, and higher education institutions in the region. This program would not be possible without their contributions. Thank you all, and be well.
Kevin.
Thanks, Kevin.
Thanks, Kevin.
Thank you, Kevin.